Welcome to our next learning unit where we're going to continue our discussion on complementary and integrative health and healing, especially those techniques or approaches or modalities that are used in chronic illness. And we're also continuing along our path of mindfulness and looking at mindful self-care. So by the end of this learning module, you're going to be able to reflect on your body's needs and apply self-care strategies such as meditation while at work at home. We're going to be able to examine and look at the Veterans Health Administration's whole health program for those with chronic illness such as chronic pain, diabetes, mellitus, and addictions. We're going to be able to look at acupuncture, which is a traditional Chinese medicine approach, and the VA's use of battlefield acupuncture for veterans with chronic pain. We're going to be able to analyze the potential use of acupressure instead of acupuncture in nursing practice and become more familiar with at least one common acupressure point for nausea. So you have a few learning activities for this learning unit. First of all, Chapter 5, Mindful Self-Care, is a chapter within your Mindful Nurse book. Then you're going to complete quiz 6 after you've done the readings, because the readings are what quiz 6 is based upon. And you will have 2 attempts to complete the quiz, and it's not timed. So if you choose to go back and correct one that's inaccurate and retake the quiz, you can do that. You can take the quiz twice. The next article on meditation for diabetes mellitus type 2 is really quite an informative, brief article that's recently been published. And what I like about it is it also discusses a bit the physiological stress response and how that worsens glycemic control. So this is going to be an article that's important in answering the second part of the discussion board post. The next article is really in follow-up to our last learning unit, and it takes looking at meditation a step further by looking at some of the recent literature on meditation. And while this study was not done just with meditation, what they demonstrated is that integrative health services can enhance one's quality of life. And you think, okay, that makes sense. And they specifically studied a population of breast cancer patients that were undergoing treatment. And they demonstrated that these, I think it was almost all women who were undergoing these treatment, the ones that had access to integrative health services, such as meditation, actually experienced a longer life expectancy. So check out this article, and I think it will bring further light into our practice of meditation, along with meditation for diabetes type 2. I think both of those are beginning to give you perhaps a closer look at the evidence that's coming out and has been out for some time, but more rigorous studies are being completed that really demonstrate that integrative care, the best of mainstream medicine and complementary therapy approaches, truly is significant in patient outcomes. And then we're going to look at what I think has been very exciting is the VA Whole Health Program. So this is a 7-minute video. And when you get to the 3-minute point, just pause it for a minute, because I do want you to look closely at the wheel or the circle of health, that the model that they use. And the VA Whole Health Program has been the Erie VA was a pilot in, oh geez, now it's going back probably 6 or 7 years to this whole health program. They were one of the first VAs that began using this and continued to use this whole health program. Highly successful. So I think you're going to find that interesting. And then going back to the National Center for Complementary and Integrative Health through the National Institutes of Health, there is information about acupuncture. So, of course, acupuncture is actually puncturing the skin, as we see here, with a very tiny sterile needle. But the effectiveness in this of acupuncture in treating pain and other conditions. And please note that this is a web page, and as you scroll down, don't forget to really review the information on auricular or ear acupuncture and acupressure, because that's what you're going to see also utilized at the VA. And acupuncture, they talk about battlefield acupuncture. So we're going to look at battlefield acupuncture at the VA next. And not only is there acupuncture for pain and auricular acupuncture, but I also had the opportunity to have training at our Erie VA in acupressure, auricular. So again, along the different areas of the ear, auricular acupressure. It was quite amazing to see the different points of acupressure on the ear, and what different points could do and help with. And we actually, instead of taking little needles, the acupressure course was for nurses at the VA. And there was little beads that we would put on the ear, attached to the ear, and the patient themselves, after we taught them how, would put pressure onto that little bead in a specific point on the ear for chronic pain, nausea, anxiety, depended on where that point on the ear was. So it was a pretty exciting experience. And but let's start by looking at acupuncture. And then the last thing for acupressure that we're seeing more and more commonly. In fact, my son, when he came to visit with his two small boys, they had gotten car sick, and with a 6-hour drive from Washington, D.C. to Erie, without me involved at all, he went ahead and got the little bands, the acupressure bands, and applied the bands to each of his son's wrists, and at the P6 site. So it was interesting to see. Now, again, this is not a study. This is just the experience according to my son, and that was that neither boy was nauseated during this 6-hour most recent travel. But you're seeing those used. So let's educate ourselves on what they are actually doing. So the pressure point that's stimulated to relieve nausea and motion sickness. But read through this, because I think you're going to find this interesting. If you use this at all for yourself or with your children, or maybe even sitting with a patient who is going through chemotherapy, and with their permission, you can use their fingers to locate the P6 point. So take a look at that. I just found that was very interesting, and not that nurses are all going to start doing acupressure, because it takes training and it takes skill. And this is just being aware of what many people are doing. So, and especially when we're dealing with the older adult or when we're dealing with the individual with chronic illness and chronic pain, or chronic nausea, um, this one point could be very effective, but acupressure could be very effective too for dealing with chronic pain, and especially areas of the ear and auricular, acupressure. So I want you to look a little bit at acupressure, and just know that acupressure is and acupuncture are very similar. And to end, you're going to be completing the discussion board post, and I'm asking two questions. Number one, how does complementary and integrative healing modalities enhance the quality of life with patients with chronic illness? And summarize in your post the body's physiological response to stress, including stress, chronic stress. And this is where you're going to want to review the article on meditation for diabetes type 2 to best answer that question. And then as you've been prepared for the last couple weeks, this is your place to submit your herbal presentation. So thank you and have a good week.